Good evening. I'm Mike Fortune, and I will be your host for this, our weekly town hall meeting concerning the COVID-19 outbreak in the city of Hamilton. We welcome everyone watching and listening on Cable 14, 900 CHML radio, and on the City of Hamilton YouTube channel. Once again this evening, we are broadcasting live from the council chambers down here at Hamilton City Hall. And before we start, it is very important for you to know and understand that we are following all recommended procedures, including physical distancing, for tonight's broadcast. In order to promote physical distancing, this town hall is entirely virtual. Only essential personnel are here in council chambers. In-person attendance is not available for residents or media. And tonight we will continue to share the latest information and answer many of the questions you have regarding the current status of the COVID-19 outbreak within our community. We have a panel assembled that will spend the next hour answering as many of your questions as possible. Joining me once again this week here in council chambers are Mayor Fred Eisenberger, Mr. Paul Johnson, Director, City of Hamilton's Emergency Operations Center, and lastly, Dr. Elizabeth Richardson, City of Hamilton's Medical Officer of Health. We welcome your participation in tonight's town hall meeting, and you can submit questions in one of two ways. You can go to the city's website at www.hamilton.ca/askCovidQuestions, or you can reach us on Twitter by tagging @CityOfHamilton in your tweets. As this health emergency continues, the city continues to receive numerous questions. And once again this evening, our staff are monitoring social media and the website, and we will get to as many of your questions as time allows. But before we start with tonight's questions, Mr. Mayor, would you like to begin this evening with the current status within our city?
Well, thank you very much, Mike, and thank you to CHML and Cable 14 for continuing to broadcast this. I think that's what I'm hearing in the broader community is that this is very helpful for a lot of folks. So happy to be here, and not happy in terms of the circumstances we're in, and we certainly thank all of our community members that are listening to our public health officials. These are very, very important recommendations and closures that we've had to put into effect. And the fact is that you are the first line of defense in this virus crisis. If you do what you are asked to do, then we can shorten the time for any of the closures that we have been dealing with. So thank you for your effort. For those that aren't adhering to that, we're going to get a lot more significantly enforcing these measures to ensure that you are not putting yourself and/or anyone else at risk. And we certainly ask people to continue to wash your hands, stay at home as much as possible. If you're going to go out and do groceries, do it once a week. Go to the grocery store, go directly back home. Treat your groceries. Some are recommending a wipe down when you get home. And make sure that you do not corner the market on any one product. Leave something for someone else. There's no need for hoarding. The community, the trucking industry, and the supply chain is doing just fine. I find myself, kind of shocked when I say this, but we have announced as of yesterday that the closures that we put into effect will last, or at this point, until May the 25th. And I'm still stunned when I say that, but the reality is this is going to be necessary. If we defeat this virus sooner, then of course we'll make adjustments to that. And if it goes on longer, we'll adjust again. But right now, as it stands now, all of our City Hall, all of our recreational facilities, all of our service centers, all the closures that we've announced, including the trails, the parking lots around the trails, the Conservation Authority parking lots, just about everything other than roads and streets have been closed to ensure that we're maintaining separation and not spreading this virus. Harsh reality, but a reality nonetheless. And if you're watching the news at all, you can certainly appreciate that this can go very wrong very quickly. We're already seeing increases in the cases that we have, and fortunately, we've had minimal amount of death. But the reality is that should we not be able to get on top of this, then these issues are going to continue to increase. So do go to the Hamilton City Hamilton website and get all the information there. We'll give you those website and hotlines are on the screen. Visit that. All the information you need is there, including how you access federal funds and all the programs that are out there. And thank you, Mike, and I'll turn it back to you, sir.
Oh, Mr. Mayor, thank you very much. Let's move on to some of those questions now that we have been receiving from our viewers and listeners. And we're going to start with you, Dr. Richardson. Can you share an update about the number of COVID-19 cases here in Hamilton and the current situation as of this evening?
Absolutely, Mike. So today we're at 112 cases here in Hamilton as of noon today. About 23% of those now are due to community spread. We are still clearing up the backlog of test results that have come as the public health lab was having to sort of slow things down due to the lack of chemicals to process those tests. But now there are a number of labs that are kicking in and things are working much more smoothly. So for some people, they're experiencing their test results are back within about 3 or 4 days, and for others, they're still clearing up that backlog, as I said. So we're getting there. That's 11 more cases than yesterday. So our rate of increase in cases is continuing, but is not as bad as one might fear. We do have 9 people in hospital at this point. 15 have ever been hospitalized, so about 15% of those cases overall. 2 of them are in the ICU, continue to be in the ICU, so those are the severe cases that we're worried about. And remembering what we're trying to do here is to prevent as many deaths as we can, to keep our health system from being overwhelmed, and to reduce the impact it does have economically. And so when we see those numbers, this is where we want to keep things. We want to keep things very manageable. And so the actions that people take, the actions to physically distance from one another, to follow the advice that you've just heard the mayor speak to, is so very, very important to us in terms of where this is going. And we really call on all people to continue to do those things. Travel history continues to be sort of the most important aspect in terms of overall. But again, as things shift, as we move away from the March break, with travelers having come back, community spread is much more of an issue. We have had 2 deaths now due to COVID-19, but again, that is exactly what we're working to try and prevent.
Dr. Richardson, thank you very much. We're now going to move along to Paul Johnson. Paul, yesterday you announced that the city has decided to suspend all programming and extend the closure of facilities, playgrounds, and other city amenities until May 25th, as the mayor also alluded to. Can you tell us a bit more about these closures and what residents can expect in terms of available city services during the closures?
So in terms of the closures, the things that were already in place will continue for this period of time. And of course, alongside our announcement were some increased orders from the provincial level to close amenities, both public amenities, so those that the city would operate, or other public institutions. But the other thing is that private entities must close some of their recreational amenities as well. So really, when we looked at the evidence about how long this is going to go, we knew extending our closures for just a week or 2 was not where this virus spread was at. It really is more like the couple of months that it ended up being. And that's a tough decision, but we have to do 2 things. One is be realistic about when we might actually be looking at reopening some or all of the facilities and services. And 2, we need to give ourselves some time to do that when that time comes. So our mayor has been very clear that this was early on not something that was going to be over in a matter of days or even a few weeks. And as you see now, it's going to be a couple of months at the beginning. There is no magic to the date. I would love to say that between the mayor and Elizabeth and I, we have pinpointed the absolute date when everything will open up again. We don't have that power and ability and knowledge. What we do know is that that's probably the next opportunity for us to assess the situation and see what can happen. In the meantime, lots that you can do with the city online. You can apply for childcare subsidies. I understand childcare centers right now are closed, except for essential workers who can access free childcare. But you can apply for the subsidies so that when childcare comes online, families in need of childcare can be in the queue to get that subsidy. For our low-income residents, Ontario Work applications can be done in more virtual ways. You can register some complaints, as we'll talk about, I'm sure, as this evening goes on. You can license pets. You can apply for building permits and do some of the work around the construction and keeping that investment in this community going. Even things like open-air burning permits, which are very important for certain parts of our more rural communities in Hamilton, can still be done during this time frame. So our staff have adapted, our programs have adapted. The city's always had a great online presence for service delivery, and we encourage everybody to use those as best as they can. And as always, I remind the public, our essential services, our life safety services, things like our water system, our police, fire, and ambulance services, those types of things, our long-term care facilities continue to operate. Some of them with slightly different approaches to it in terms of our long-term care facility, but they continue to be there to deliver the essential services that we need.
Thank you very much, and of course, a big heartfelt thanks to all of our first responders that are out there. Mr. Mayor, next question coming in to you. In recent days, the city has put out a call to the community for donations of personal protective equipment, otherwise known as PPE. Can you tell us what kind of equipment is needed and how residents and businesses can go about donating these materials?
Yes, thank you, Mike. And I'm sure most everyone has heard in the news that there is a critical need for all of these personal protective equipment items, PPEs, as they say. I will say that they are surgical masks, N95 masks, impervious gowns, gloves, face shields, swabs, and hand sanitizers. Those are all items that we could use that, if you have a business or you have a dental office or you have a salon, therapy clinic not operating right now, and you don't need these supplies right now. They can be well used at the front lines in the healthcare system, so get them to us. You can get a hold of us by contacting us at ppe@hamilton.ca, and we can arrange to have them picked up. And there's also a phone number you can contact us at, which is 905-546-2424. Extension 2257. If you call that number, we will arrange a pickup somewhere in the downtown, if possible, so that we can get all of that supply and equipment into the hands of the frontline healthcare workers and long-term care support workers that are out there. Very important, as this thing has been escalating, the amount of use for the equipment for the frontline workers to use that equipment has to be turned over rather quickly. So they can't be reusing the masks, they need another one. And so a lot of this stuff has been gone through quite quickly. We need more. Whatever you can provide would be very helpful. So again, ppe@hamilton.ca. Get a hold of us and tell us whatever you've got, and we'll come and get it.
Thank you very much, Mayor. And again, just one more time, that phone number as well, I wrote down 905-546-2424, extension 2257, if you'd like to donate some of that personal protective equipment. Thank you very much, Mr. Mayor. Dr. Richardson, back to you. A question has come in. Can you talk a little bit about the tests for COVID-19? Who should get tested, and what is the timeline for how long it takes to get the results back?
Absolutely, Mike. And I'm going to come back to one more thing about the current situation that I didn't say earlier, too, and that is around the number of resolved cases that we have. So what happens if a person does end up testing positive for COVID-19 or has symptoms like COVID-19? We do ask them to self-isolate, of course, for that 14-day period. And then once they reach the end of that period, if they are feeling well, if their symptoms have resolved, then they're able to go back about their business. They're able to come out of isolation. So we're happy to say that we have 34 people already out of those 112 that have gone through that time period, that they have become asymptomatic and they're able to get on about things again in their lives. When it comes to testing, though, we are still in a situation where there is a concern about the amount of PPE that the Mayor's just been talking about, the donation drive we have on. We know globally there is demand for this all around the world, and so we hear all about people trying to retool to produce this here in Ontario, here in Hamilton, and around the world to produce it faster because the demand is truly there. And so while we have this restricted supply of PPE, we're actually limiting testing to a few particular groups. So absolutely you need to be symptomatic before you should be tested. any physician or other healthcare worker is going to do their own assessment about whether or not an individual needs testing. But we're prioritizing symptomatic healthcare workers, regardless of where they may be working, whether it's in long-term care or in a hospital or other sort of facility. So we're wanting to test them. We're also testing symptomatic residents and staff in long-term care homes and retirement homes and other institutional settings, because of course there we're very concerned both in terms of the density that people live in and the potential for the disease to spread, but also those of course contain some of our most vulnerable people, whether they're older individuals or people who are homeless. They're quite vulnerable to the complications of COVID. So they're definitely a priority group to test. Hospitalized patients, of course, are a priority group who have respiratory symptoms. And overall, we're very interested in testing people who live in remote or Indigenous communities, within the province as a whole. As well, symptomatic travelers are very much a group that we're concerned about testing. And finally, of course, the contacts of any cases that we have are there. So for now, we're really focusing and prioritizing testing there. We know testing does have a significant role to play as this goes forward. So as supplies hopefully become more available, we are anticipating that might get broader, but at this point, we're still focused on those priority groups.
If you don't mind, I just have a quick follow-up question regarding those 34 who are now free and clear. Are they now immune to the COVID-19 virus, or is there a potential that they can maybe catch it again?
So that's really one of the million-dollar questions that's out there about will people be, permanently immune to this virus as it goes forward? And we're still learning about all of that. Many people are betting that is the case, but we'll know better over the coming weeks.
Thank you very much. Paul, we're going to head back over to you. A question has come in that there have been a lot of changes to HSR. We touched on it last week regarding the service in light of COVID-19. And we've had lots of people write in with questions related to the challenges of keeping appropriate physical distance on boarded buses. Can you speak to the status of public transit here in our city and let customers know what they can expect in the weeks ahead?
So the first thing I'll say is I'm incredibly proud of our transit system. We continue to operate our transit system. Some people may have noted that other municipalities had an entire shutdown of their transit system. And I think that speaks to the work that's happening between all of our drivers and operators and mechanics and all those that keep our transit system going. And ourselves in the EOC, we're constantly made aware of the challenges that they face. But I will say, Mike, that as this virus progresses, and particularly now that we're into an increasing amount of community transmission of the virus, some additional measures are going to be taken by HSR beginning this Friday. We're going to begin to limit customer loads, so the number of people on buses, in order to help keep those numbers down. That helps the passengers on the bus to keep some separation, but it also helps make sure that we can keep a good physical separation for our drivers. And so there will be pass-bys. There will be buses that drive by when they are at this capacity. And it's about 10 people on a normal bus and about 15 people on the articulated buses. There will be a further separation of our driver from passengers, and we are going to begin asking on Friday that all customers enter and exit through the rear doors of the buses. This also means that for people using mobility devices, including wheelchairs and scooters, that they're best to travel with someone, a companion, that can help them get on and off the bus, because they're no longer boarding through the front of the bus where the operator would assist them. And that's going to create some concern, I understand, and some challenges. We're trying to balance with HSR how they continue to operate and how we continue to deliver service with the ability of people to actually use this transit for what it's recommended for, which is essential trips only. This will mean for customers that sometimes you'll need to wait for a second or third bus. I did report earlier this week that we are putting additional buses on heavy routes at heavy times. While we're not able to get back to our full Monday to Friday operation yet, we do have additional drivers available, and so we're putting them on the road when we can to try and limit this. But the Barton, the King, the Delaware, the Beeline, those are the routes that are most affected by these changes, and at certain hours of the day. Traveling by transit will not be as effective and as it has been during normal operations. But our entire goal here is to keep transit going. And these are the kinds of difficult decisions as this virus progresses and it changes in terms of how it's working in our community. These are the kinds of things that we're moving forward. Most of our transit operators understand and are thanking daily our drivers and our operators for the work they're doing. I'd just remind the public that the drivers are simply trying to do their job. They're trying to be safe at their job, and they're trying to continue to do it. Taking your frustrations out on them is not helpful. And to employers in this community for whom transit, we're really trying to make sure transit is on the road for people who need to get to work. For employers who can, if you can be flexible in the times that you have people coming to work, particularly those who use transit, that can help kind of level out the amount of people that are using transit. So I know some of these changes will be hard for some folks in this community. We recognize that, but that's the balance we're under right now. But we do also know that people should not be out just taking transit for transit's sake, and we strongly, strongly, strongly encourage people to only use transit when it's essential to move around the community.
Practice your patience and pre-planning going to be very important over the next little while. Thank you very much, Paul. Mr. Mayor, how is the city going about communicating with its diverse communities in Hamilton and our large newcomer population? Given the significance of this global pandemic, what is the city doing to ensure that everyone is informed?
Well, thank you, Mike, and we certainly all celebrate the multicultural, diverse community that we have. It's wonderful, and we welcome people from all over the world, but one of the challenges is to get a lot of this information to them in many languages. So currently, we translate our weekly town halls into Arabic and Spanish. We've uploaded resources from the federal government to our website to help people get quicker access to them, so some of the programs that are available. And on that site, they are available in many different languages. So they can go to the hamilton.ca/coronavirus website, and you can get a lot of this information there in multiple languages. We're reaching out into the community as much as we can to communicate, the things that people need to do. And so certainly COVID-19 and, impressing upon people that gatherings of five or more people, is something that everybody needs to do. And I know we're heading into, areas where people want to celebrate Easter and Passover and lots of, demand or desire to get together. We can't do that right now. I think what we need to adopt is a strategy that allows us to be able to celebrate that some other time. But right now we have to hunker down, and that communication is ongoing, and hopefully we can continue to do that on an ongoing basis. I can also tell you that the communications team and the Community Initiatives Group are working with Hamilton Police Services to put together an outreach plan for the broader community in Hamilton as well. So there's a lot of effort being put into trying to get the message out in various different languages and in various different ways. By virtue of what we see happening in the community, I sense that people are getting the message. Some not as loudly as others, but we'll keep reinforcing that. But I think the work that we've been doing to get the message out on a regular basis has been very effective, and we certainly appreciate the community at large responding to what we're asking them to do.
Thank you very much, Mr. Mayor. Dr. Richardson, a question has come in for you. We've talked a lot about wearing masks over the last 2 town halls, but we are still getting questions about who should be wearing these masks. Can you speak a little bit more about masks and gloves and who should be wearing them and who doesn't need to?
So I think, we've just been talking about personal protective equipment like masks and gloves, and the very biggest priority of who needs to be having those masks, having that supply of masks, that supply of gloves, are our frontline responders, our frontline healthcare workers who are looking after people day in, day out. And they are, doing the heroic work that they do in order to keep people well in this community. So, we've heard about donation drives and whatnot. If you've got them, take them there so that those people can use them. Our long-term care homes in particular are a priority to protect these vulnerable people in our community, and we know that they're an absolute priority as to who should be using those masks. So In terms of other people outside of that, there is a use of masks if somebody is presenting to their healthcare provider if they are ill. So people may be asked to wear a mask if they're showing up and they have symptoms of cough and that sort of thing, so that they aren't spreading anything to the healthcare provider that is looking after them or to others that may be in the area. So that's another place where masks should be used. In terms of, in general, sort of out there for all of us, the general advice is not to use masks and not to use gloves. And the reason for that is that actually wearing this equipment, it's actually, you have to do it very carefully. And so when you're putting on a mask and taking it back off, you need to do it in a very careful way. We call it donning and doffing masks and gloves so that you don't accidentally end up infecting yourself. You know, we've talked a lot about washing our hands frequently. You can't wash gloves. And so if you've got a set of gloves on and then you're rubbing your nose because you think you're okay, that's a challenge. You're actually putting yourself at greater risk. Same thing if you've got a mask on and you haven't washed your hands or you're fiddling with it because it's not fitting well, you're actually right there in your eyes, your nose, in that area, and have a greater chance of actually taking something that's on your hands and making yourself sick. So that's why, in general, we're not recommending masks. If we were to ever find ourselves in a place where they would be recommended, that the amount of education that would need to be done to make sure that it was done well would be huge. But so right now, absolutely our priority is to make sure those masks, those gloves are available for our healthcare workers, for our frontline responders, so that they can be protected themselves and can protect the rest of the patients that they see.
And can I assume then, Dr. Richardson, the same can be said about these homemade masks that we're seeing or bandanas that people are putting over? Again, you shouldn't be wearing those if you don't have symptoms.
To the others, these are not things that are tested, that we have any idea about in terms of how effective they are. And so people may choose to wear them, but again, we would be concerned if you're using them and having your hands more so up and about your face. We really want to keep our hands away from our face. If you're going to do that, wash your hands first before you touch them.
Got it. Mr. Johnson, next question is directed to you that we've had come in. We have received many questions about people wanting to report non-essential businesses who should not be open, I should say, or people who aren't self-isolating, or neighbors who are having gatherings of more than 5 people. How does someone go about reporting an infraction like this, and what can the city do to enforce it?
So the province gave expanded powers to the city alongside the police to enforce compliance in certain cases. Most particularly around businesses who are not living up to the order, around closing if you're non-essential, and around the gatherings of groups now more than 5 people. So at one point it was 50 people, it's now down to 5, so essentially you're not getting together in any sort of group. And we encourage people to let us know. There are fines associated with this. There is, that's the escalation point that we would go to. We often try and encourage and inform and help educate people, but there are fines attached to this, and we want to know. So folks in the community, if they just have a concern and want to log that complaint and concern, 546-CITY, our city number is the place to do that. There are a couple of toll-free provincial-wide numbers where people can inquire if a business is essential. So if you want to take that step first and ask whether it really is an essential business or not, you can call that. They're on our website, and also a provincial line around price gouging. But people can call into us for the kinds of things that they're seeing out in the community that they don't think are right. And quite frankly, the people that are concerned about this, they're on the level. It's not right. I will say that many, many people are doing the right thing, and I am really, really pleased to see that. I'm also pleased to see when people perhaps need a little bit of more education about how to do the right thing, they are quick to comply. Last night we had a situation with that, and a business quickly complied and actually sent in a letter of apology. Not necessary, the education is what we were after, but took that step to say, we're really sorry, we didn't quite meet what it needs to be. Rest assured we'll do it. I've talked about my own experiences going to the grocery store, going to the pharmacy, where specific steps have been taken to help people understand what the physical distancing looks like, and by and large, people are respecting that. I am here tonight, though, to say that we've had some incidences that we need to talk about, and we quite frankly need to knock it off in terms of some of the things going on in this community. Our bylaw officers are still patrolling our city to keep everybody safe, and they will respond to reports of illegal activity, vandalism, graffiti, illegal dumping, those types of things. We've seen an increase of it. To those who are using this as an opportunity to dump things in our community that they normally wouldn't do because we've seen an increase in it. It's not the usual offenders, there's an increase. Knock it off. For those that are choosing to tear down the barricades and take away the signs that are closed some of our facilities, we need to knock that off. We're putting these up to protect the public. We're doing it under the provincial order, and the fact that these things are being done simply needs to stop. For those that are continuing to go ahead with building projects without getting a building permit, including in one egregious case, putting a full addition on a home, knock it off. You know that our building department's open. You know that those permits can be applied for. We've said that repeatedly in these sessions, and it's on the website very, very clearly. So for those who are choosing not to get the message that no one woke up 3 weeks ago wanting to close our parks and our play structures and our stairs, and we're going to get to that. I know at some point, I'm sure there's 1,000 questions about stairs tonight, that we were going to close our rec facilities and not have childcare and have kids out of school for 6 or 7 weeks. No one got up 3 weeks ago wanting to do this. It's being done for a purpose. And for those who are doing it, our team at the city applauds you. We don't have enough staff folks to deploy to every community and every street across the whole city. But right now, we're running ragged, keeping up with what's happening in terms of a few people that are choosing to ignore this whole situation. So I thought I'd use the term knock it off because I just think that's a term I've often used when I referee. A couple of players starting to escalate a bit, and I usually just say knock it off. 99.9% of the time, that may be good enough. I'm really hoping that's the thing that carries tonight, Mike, so that we don't have to turn to our more heavy situation, which is fines or criminal charges. On behalf of our bylaw officials, I will let you know that the use of these facilities that are closed carries the fine. The destruction of our signs or our barricades could be deemed a criminal offense, and there's an even heavier penalty for that. So let's work together and do what we need to do in these times. And thanks for the opportunity to share a bit of that tonight.
Oh, by all means, fantastic messaging, and we hope more and more people are getting that message. Thank you very much, Paul. Mr. Mayor, pretty simple one for you that just came in. What will the city be able to do to help residents with their tax payments?
Thanks, Mike. So that's a question that's come up often. And because the next installment is at the end of April, we will be meeting on April the 8th as a council, and the staff will be recommending a deferral of penalties and interest for 2 months on any late payments of taxes. Now, what we're asking for people to do is those that can afford to pay, please continue to do so. If you're not having any financial challenges, we need that tax revenue. We want to continue to function in our city. We need the cash flow. So please do continue to pay your taxes. And for those that are having difficulty paying the bills and, you just bought a house and the tax bills come due and, you're scrambling and you just lost a job or you've been laid off, you'll have a 60-day deferral opportunity here to not have to pay and until such time as hopefully things kind of settle down. We may very well at council decide to add another 30 days after the 60 days, so it could be a 90-day deferral, but it is a deferral. And so we can't waive the taxes. We can't run a deficit as a municipality, although I believe most municipalities this time around are going to have some form of a deficit, and we're going to ask our federal and provincial partners to look at that as well. And we have. And they are, they're putting enormous amount of resources out to help people and businesses be as whole as they can be to be able to survive this. More money is coming, I am assured. So massive investments are happening. This is one way that the City of Hamilton can help, in terms of the tax deferral. So I expect on April the 8th at our council meeting that council will approve that, and that'll be certainly an assist for those that are having financial challenges at this point in time. I expect that, for those that, need to knock things off, that this will be one thing that council will knock off and hopefully help people in the short term, that, we all want to do our bit to make it work for everybody in our community.
Mr. Mayor, thank you very much. Dr. Richardson, we're going to come back to you now in regards to the fact that we are getting a lot of questions about where those people who have been confirmed to have COVID ID live and work within our community. Does public health share information like this, and where can residents go to find it? Your mic, please.
Thank you very much, Mike. It's a really quick answer, but I'm going to give you a bit of a longer one. The answer, of course, is no. We don't share information like that. We do collect a lot of information from people when we're going through and investigating these cases, and that information is protected under legislation. It is their own personal health information. It's private, and we're prohibited under legislation from releasing that. We also, the other issue is that there is community spread out there. We know it. We've known it now for a couple of weeks, and so everybody in the whole community needs to be concerned about this. They need to be taking the actions, taking the measures to reduce spread, the personal measures in terms of washing your hands, staying home if you're ill. And I need to emphasize that one yet again, because we continue to see when we're investigating cases that people continue to go out when they were not feeling well. And so it is so very important, no matter what illness you have and at any time of year, but particularly right now with COVID-19, that people stay home if you're not feeling well. Even if you're just feeling a little bit like you've got a scratchy throat or something like that, stay home until you see whether or not it was just your allergies and your eyes started to itch a few hours later. Stay home, please. The other thing is that when we do these investigations, as I've said, my colleagues in public health, they collect a significant amount of information. They ask all about what you've been doing in the 48 hours, up to the 48 hours before you got sick, because that's the time period that we're worried about in terms of spread having happened. And if there is any setting where somebody might have come into contact with those individuals, where there's any kind of significant contact, we reach out to those people directly. So we call them, we reach out. If it's a workplace, we reach out to the workplace to find out who was working that day and help them understand what they need to do in that workplace. And so you do see or hear about those sometimes when people are being notified. But we do reach out to everybody to make sure they know the measures they need to take. And again, if you are a significant contact of a case of COVID-19, you need to, again, stay home, self-isolate. We would be asking you to do that for that 14-day period to see whether or not you get sick as well.
Dr. Richardson, thank you very much. Paul, we're going to head back over to you in regards to a number of questions that have come in about parking regulations, where people are allowed to park and where they are not allowed to park, and what the city is doing to accommodate people who are self-isolating or working from home and now need a place to keep their car throughout the day and evening. Can you speak a little bit about how parking enforcement is currently working at this time?
Sure. So for those in a residential areas, we've completely relaxed any restrictions that might have been in place. It might have been 1 hour parking, 3 hour parking during the day. The 12-hour parking rule in residential streets, we're not enforcing that either. And on a lot of the surface lots and meters, you're going to get a pass for now. The reality is, though, we are still enforcing traffic safety and community concerns related to parking. So regardless of whether you're self-isolating, working from home, having to be home to take care of kids, you can't park in front of a fire hydrant. You can't park over a crosswalk at a corner. Those things will be taken care of, and you will get fines or whatever the next steps are in certain cases. So we're asking people to do the right thing in terms of the safety of the parking. Don't go to places that we've closed off and park on the roads around them. We've closed the parking lots for a reason. It's because you're not supposed to go there. Over 300 people were at Albion Falls today, despite the fact it's closed. Many of them chose to park any which way but Sunday around the area, and so we were enforcing that. Again, our resources are focused on this emergency at hand, and we really don't want to be spending our time having to do this kind of thing, but we will enforce parking that we consider to be a safety issue for the community.
Thank you very much, Paul. Mr. Mayor, back to you in regards to next week, and it's going to be the city's first virtual council meeting. Can you tell us a little bit more about this and how it will work? Will there be opportunities for residents to submit videos or presentations electronically for review by council or committee?
Well, thanks, Mike. This will be a first for this council, probably in the first, for councils across the country. So out of need, we're going to do a virtual council meeting, which means that all councillors have been equipped with laptops and microphones, and they can dial into Zoom from their home. And the only person that will be here is myself conducting or chairing the meeting and a couple of clerks. And we will have an agenda that is modified, so clearly it'll be, the urgent issues that need to be taken care of. It won't be the kind of agendas we've had in the past where, there's reams and reams of material. We're going to narrow the focus here on some of the critical things that have to be done, including the tax deferral that we talked about a little while ago. Anyone that wants to delegate will only take written submissions at this point. The agendas will be distributed as we do in all cases at the appropriate time, at the appropriate hour, but many days before the agenda is finalized or before the meeting is done. And so people can look at the agenda, they can make written delegations, we'll entertain them all. There'll be interactive dialogue between council members, debate as we normally would in all instances, but all of it will be done through the benefit of Zoom, and people can dial in through the city's live stream. That will be ongoing, so you can watch and observe, as well as on the YouTube channel. So it'll be a fully public meeting, virtual.
Wonderful. Good stuff. Thank you very much, Mr. Mayor. Dr. Richardson, back to you now. Are there any specific directions you would give to those residents in our community who are older or immunocompromised?
Yeah, this is a group of people that we're quite concerned about, and these are the people we're really trying to protect with all of these measures. These are the people that are most at risk for severe complications, for getting viral pneumonia, ending up in an ICU, and perhaps, unfortunately, even passing away. So these people, we're asking them, you've heard the Chief Medical Officer of Health, David Williams, talking about the importance of these people going into protective isolation. This is a recommendation. It is, of course, their choice. They can't be ordered to do so, but it is highly recommended that they stay home and isolate themselves. So in these instances, it's so important that our community pulls together to support these individuals so they can do just that. So these people will still need groceries, they will still need their medications from the pharmacy. Ideally, they don't have to go out for those things. Fortunately, there are some businesses that are setting aside some hours so that they can know that they're going, and it will only be those types of individuals that are allowed into the store during that time. But better yet, if they can manage to get what they need through online shopping, or they can have a friend or a neighbor or somebody who helps out to get those essential items, it's very, very important. I know there have been community groups and others that are working to support these individuals, and so to continue to look to those rather than leaving the house themselves.
Thank you very much. Of course, just be that good neighbor. If you have their phone number, give them a call, check in on them, say hi. A little conversation would be good for them too, no doubt. Thank you, Dr. Richardson. Paul, back over to you. You touched on it briefly. Here is the question, I think, maybe of the day. Can you clarify what the status is with the escarpment stairs? Are they open or closed for people to use?
7:43 before we get to stairs. Unbelievable. They are closed. And that little quip aside, tough decision. You'll see at the City of Hamilton, we have typically not jumped out in front in terms of closures. We've typically waited a little bit. We've been behind other communities in terms of closing certain things. This was a tough decision because we know some use the stairs for essential travel. They actually use it as the way to get to work. The reality is too many people were using them. We repeated messages for a number of days about essential use of the stairs only, and it simply was not being followed. So it's a difficult decision. I understand the impact that it has on individuals, certain individuals who are using it as a walking route to get to work. But they are closed, and they're signed as such at both the top and the bottom, all the escarpment stairs.
Thank you very much. And basically, following up on the bus situation, you just have to pre-plan a little differently now. Thank you very much. Mr. Mayor, coming back to you now. Every day it seems like the federal and provincial governments are announcing new support for Canadians and Ontarians. Can you talk a bit about the city's involvement and collaboration with the upper levels of government and highlight some of the key ways Hamiltonians can access these supports?
Thank you, Mike. And yes, this has been actually a very interactive effort between the federal, provincial, and municipal governments. We're in constant contact with Minister Freeland, who is typically our contact going forward, the Deputy Prime Minister. We have many, many calls to my office, actually, from many of the ministers in various departments, including the Minister of Labour, the Ministry of Social Services. All of them are interconnecting quite effectively, as well as the provincial ministers, and they've been equally terrific. The Minister of Municipal Affairs has been calling in regularly and asking, what are we missing? Where else do we need to go? We mentioned to him a little while ago that great that there was resources being put out there for property owners, but what about the renters? They're going to have some significant resources delivered to them to help them pay their next rent. And so how can we manage that? And I sense that they're responding to those requests and wanting to know where most of the activity is happening is in the larger municipalities in the country. What's going on there? How is it working? So we work through FCM and the Big City Mayor's Caucus. There's 21 of us that represents that section of the FCM, and a lot of interaction happening between those major municipalities and our federal government in terms of the programs that they're putting out. And we are assured by the government that have already put out some $130 billion worth of supports for businesses and individuals, that there's more on the way. They understand that as we get through this, that the economy will take a pretty significant hit, and it needs support. In every sector, and the assurances that we're getting is just they're rolling it out, and we'll continue to roll it out to continue to support the economy and the people that are in it, so that we can hit the ground running when the coronavirus is behind us, and we want to get our economy, thriving again as it was prior to this. So I'm really delighted with the level of interaction and cooperation that we're seeing. It's basically leave your political stripe at the door. It doesn't matter now. What matters now is saving lives, and everyone's on the mission. And I've seen no negative political backlash. I've seen no negative political backlash here at council, quite frankly. They've been terrific. All of your members of council continue to work. All of their phone numbers and all of their email addresses are live and active, and they're interacting with their constituents all the time. And if you need anything from them, you can get a hold of them anytime during the day. They will respond and get you directed to the right place. So the level of cooperation that we're seeing is really the kind of heartwarming kind of collaboration and cooperation that we would like to see all the time. But now, given this crisis, it is binding everyone together on a common mission, and I think that should be comforting for our residents and the citizens in the country, let alone in Hamilton, that we're all working to the same end, preventing the spread of this virus, supporting the economy, and supporting individuals and businesses that are in it, and making sure that when this is over, that we have an economy that we can go back to.
Mr. Mayor, thank you very much. Dr. Richardson, back over to you now. Are we preparing any temporary hospital sites here within our city?
So here in Hamilton, across Ontario, across Canada, we are, of course, taking some very extraordinary measures. All the things we've talked about tonight, when we talk about physical distancing, we talk about closing non-essential businesses, ordering people not to get together in groups of more than 5. And there's evidence from around the world and evidence across the country in BC as well that these are having an impact, that these are helping to reduce the number of deaths, to keep our healthcare system in a place where it can respond and look after people as much as possible. But nonetheless, we need to plan for what might happen. We always need to look at best and worst case scenarios and plan for both. And so yes, indeed, our healthcare system partners are planning. They're looking at how they can increase capacity here in Hamilton and across Ontario and elsewhere. And of course, they're looking at all options. They're looking at what can they do inside the hospital walls. They're looking at what they could do, what role other sites might have to play. So incredible efforts that are going on, of course, amongst the frontline workers that are dealing with the issues every single day, but also amongst all of those that are working to plan and ready us should we need them to have those resources there for us.
Thank you very much. Paul, we're going to head back over to you. Can you talk a little bit about the cancellation of leaf and yard waste? Why did the city make this change to waste collection, and what other changes can residents anticipate as we move ahead over the coming weeks?
So the leaf and yard waste decision was a decision based on the realities of running the operation of the city of Hamilton with less workforce to do so. We had coming off the March break period of time, nearly 120 employees that needed to self-isolate for 14 days by the orders that were coming down federally and provincially, and just the good advice that we were getting locally as well. And so we're constantly in each of our services looking at how do we run our programs and deliver what we can with the people that we have, also planning that this virus is that curve is, we're not through it yet. So there is an expectation and a planning that we will have other people calling in sick. They may not be sick themselves. They may be caring for somebody in their home who's sick, or a loved one or a neighbor who's sick. So we may have absenteeism that's higher than average through this next couple of months. So all of that factors into our thinking. And in terms of waste collection writ large, we prioritized collecting garbage, doing the composting and our recycling, and the piece that fell by the wayside was leaf and yard waste. It's still accepted at our transfer stations, so people can take it there themselves, but this was a way of curtailing a bit the programming and the operations that we have so that we can continue important things. And that's what we have to prioritize each day at the Emergency Operations Center. And we felt that the garbage collection, the green bins and blue boxes were important, prioritized above leaf and yard waste. The other thing with that is we don't see any other changes coming at the moment. Those will change day to day as our workforce numbers will fluctuate through this next period of time. But all things being equal, we believe we've planned to be able to maintain the collection of garbage and of recycling and of composting in the same way moving forward. I know there was a question, might have even been a week ago, about are we going bi-weekly, are we doing those things? At this stage, we're pretty stable, which is great. But I want to finish by going back to that reason why. Across all of our programs, transit has not been curtailing its service because we want to or we just think it's a nice idea. It's that's the size of workforce that we can use to put that on the road. Not every job that we have at the city can be done by any employee. And so in some cases, we have to work with what we have to work with. Our paramedics, we expect that some of those will be off the road for times. They may come into contact with a patient that then tests positive. They have to self-isolate. So all of the work we're doing each day is looking at our workforce, determining the best way to deliver our services, and to help keep all of our frontline service workers safe. Please, I know a lot of people like to interact with our workers. Sometimes it's negative. Parking enforcement sometimes gets the more negative side. Waste collectors often get people coming out wanting to engage. Please keep your distance. Just put your garbage out. Let our collectors come and do their job. You can collect your bins later. We want to keep that physical distancing so we keep all of our folks safe so they can continue to deliver service.
Paul, thank you very much. Dr. Richardson, we're going to head over back to you. The question that's come in tonight is what direction can be provided to people who may be required to work in situations in close proximity to others where physical distancing is going to be a challenge?
Thanks, Mike. Those are situations, of course, they are challenging for everybody involved. In those, we've had the general request for all employers to look at their work. When we think about preventing the transmission of illness, we think about different levels at which we can prevent that. And the use of personal protective equipment is that last sort of level. But there's lots of things we look at, like how can you change the process so that people don't need to be so close? How can you put a physical barrier in between? And so many of us will have seen in grocery stores, for example, where they've put up plexiglass with a small area where the pin pad can go through so that you can pay with your Visa or your Interac debit. So there are many different ways. And so for employers to look always at the work they're doing and look at those different ways that they could prevent there being contact between the employee and other people is really, really important. So as I said, there are a number of different levels of control. Can you change the way you're doing that business? You know, we've seen that with people working from home and doing things online. Can you put physical barriers in place? Can you make other changes along the way and in order to keep people safe?
Dr. Richardson, thank you very much. We're about to wrap things up here, so thank you to everyone who's been watching. Thank you to everyone for their questions tonight, and to everyone on the panel for your answers. But before we end tonight, Mr. Mayor, and this virtual town hall, I'd like to come back to you. Do you have any final thoughts or comments that you'd like to pass along to this great city?
Sure would. And obviously we're all in this together, and clearly, the success of us getting through this really lies in the hands of our citizens, the people of the city of Hamilton. All the recommendations that are being made here and all the changes that we're putting into effect are going to be have to be followed by you. And we're not doing them because we like them, because I like them probably less than most other people. I'm missing my tennis matches and my walks on the waterfront, and I like to climb the stairs. I like to do all of those things, but we can't right now. And so please listen to the advice you're getting from our public health officials. This is very, very important. It is a matter of life and death at this point for a lot of people. And you are a carrier, so assume that you are. Act like you are, that if you get too close to someone else, you could spread the virus from you to them. And that might mean a much more significant problem for them than it might be for you. And so for your grandparents, for your children, for this community, listen, stay home as much as humanly possible, continue washing your hands, maintain that separation. And I did notice that downtown at one of the banks, there was a lineup outside the bank. I know most businesses are doing that spatial separation inside their doors. They might spend a little time also doing the same outside. People need to stay separated no matter where they are. If you're lined up outside of Costco, it's a hockey stick apart. If you're lined up outside the bank waiting to get in, it's a hockey stick apart. Wherever you are, keep your distance. Don't spread the virus. We're all in this together. Together, we're going to see it through.
It certainly is about awareness of yourself and others, and as Paul alluded to earlier, just knock it off, folks. Knock it off. Look after yourselves. Look after your city, because I really don't think we want to be stuck indoors all summer. Mr. Mayor, thank you for that. As we get to the close of tonight's program, we also want to remind you once again that the city is accepting donations of personal protective equipment to provide much-needed resources for the citywide response to COVID-19. The equipment will be provided to frontline workers, emergency responders, and other healthcare professionals. The types of equipment that will be accepted include surgical masks and N95 masks, impervious gowns, gloves, face shields, swabs, and hand sanitizer. The city is requesting these items from local healthcare providers, pest control, hospitality providers, nail salons, and construction companies. Homemade equipment will not be accepted. And to donate, we ask that you email ppe@hamilton.ca or please call 905-546-2424, extension 2257 for more information. Again, we'd like to thank our panel, our American Sign Language translators, and our production team for making tonight's town hall possible. We will continue to broadcast these live virtual town hall meetings each Wednesday evening, beginning at 7 p.m. Please continue to monitor Cable 14 and other local media outlets daily for the latest news and updates from the City of Hamilton regarding the COVID-19 outbreak. We all must continue to do our part to ensure we get through this together. Hamilton, look after yourselves, look after each other, be safe. Good night.